very cool. You are the coolest doctor I've ever seen in my life. Like, confidants, if you are not watching at youtube.com/KelseyDarragh, we have Sanjay, Doctor, yeah. Sanjay, the Onk Doc.
Yes.
Which is a great handle.
Thank you.
From TikTok. TikTok famous. Y'all know I love to have my TikTok stars over. I've been like balls deep in TikTok, wellness TikTok for a while because of my life with chronic pain, yada, yada, yada. But I saw your TikTok like 2 or 3 weeks ago and I immediately DM'd you and was like, please come over and be on my podcast. And you were like, I'm going to be in LA.
Right.
You look like you fit right the fuck in LA.
Thank you.
You've got a hoodie over a jean jacket.
Wow.
Your hair is like a movie star. Not a single pore can be seen. Aren't you supposed to be like tired and like grumpy and angry as a doctor?
I think, yeah, you play that on TV at least. Yeah.
Yeah. Okay. Fair enough. Okay. So you're an oncologist?
Yes. So I have 3 specialties. I am a medical oncologist and a hematologist. So usually people do both of those together. And then, so like hematology is like blood disorders.
Explain, please.
Right. It's complicated blood disorders. It doesn't have to be cancer related. So it can be like, predispositions to bleed easy or clot easy or have what's called thalassemias and all kinds of weird stuff you really never heard about unless you know about it.
But I learn on your TikTok.
There we go.
Oh, by the way, confidant, sorry, before you introduce the rest of your beautiful accolades, because I'm very, very impressed by you and the fact that you look cool and you have your whole life together. You guys might not recognize the studio. You might be like, where the hell are you shooting? This is my new office. This is the new podcast room. It's not set up yet all the way, so you're being so kind to like let me.
I love it.
Totally futz around with the setup, but that's why things look a little different. And also, I should mention, because you are a friggin' working doctor, you've been vaccinated twice.
Yes, well, I got both, and then I already had like the immunity antibodies going into it. So
congratulations. Wait, was that shocking to you? Were you kind of like, wait, oh my God, I had it and I didn't even know it? Or
I think so, because like there's a lot of blood disorders that happen with COVID, which I don't know that a lot of people talked about. So
no, we'd love to.
Yeah, I mean a lot, and it happens a lot. But that's what so I was working like kind of throughout January, February, March, and at that time we didn't really even think to suspect. No. Yeah, so I think that must have been when, because I don't remember having symptoms.
Yeah, and so you were gonna finish telling us what 3 things you are. You're a blood specialty doctor,
specialist, hematologist, and then medical oncologist, which is like cancer, all cancers.
Cancer doctor.
Yes, blood and solid tumors and all that stuff.
And then is there one more?
And then so to do that, to specialize in those or cardiology or anything, you have to do internal medicine residency. So I'm certified in that too.
So like, wow, you guys, confidants, we have like a dead ass expert. Because I tried to do a COVID episode like last year when it first started, and people were like, "You are so dangerously not like saying the right things." And I was like, "Oh my God, you're so right. I should like only have a doctor on here." But you're a dead ass doctor.
Yeah.
You're a TikTok star. And how old are you? Because you look like a young baby.
Well, thank you. 33.
Wow. Yeah. How do you have that much accomplished in your life at only 33? Don't you have to be like old and angry again and tired to be so certified?
We have 3 kids, so I'm pretty tired.
You have 3 kids?
Yeah.
And you're married, so no comments. I don't want to hear it. He's not single, y'all. Don't accost a married man. The confidants have been known to do that whenever someone good looking is on the podcast. They're like, excuse me, sliding into DM. So I'm caveating with that. Wow, you were very accomplished.
Thank you. I mean, a lot of it was her too. Like, so she was a year ahead of me in med school. She's also the same 3 specialists. So we're both.
Oh my God, so you guys are raking in money.
No, I mean, we're raking in debt right now. I think in 5 years that might change.
Fair.
Yeah.
Wow, and so did you guys meet in school?
Met in med school like 7 or 8 years ago, and then we had our first 2 while we were both in fellowship in Hemonc, and then
oh my God,
once it's yeah, you don't sleep much.
What the? Oh, that's your phone. I was like, is there
some Dave Brubeck?
You're in LA, but you normally live in New Orleans.
Baton Rouge is like an hour west of New Orleans.
Oh, sorry. Yeah. Same thing to me.
Thing, right.
All of Louisiana is basically New Orleans, I think, to the majority of uneducated Americans like me. It's so intimidating to have like such a smart person in the room. No, I'm dead ass like so nervous because you're just so like doing good things for the world. And what you do with your TikTok is like why I totally fell in love with your content, because I was like, oh my God, this is like a young, cool guy. You're like doing the fucking dances and shit. and you're spreading information to so many, I mean, like what I see is young women who often get overlooked in the medical industry, and all the people that are commenting, like you comment back, you literally DM'd me and were like, what are your blood results? I'll help you with your like thing. Like you're so willing to help people. So maybe can you tell me a little bit how you went from like just being a regular old 3-time specialist doctor, successful guy to TikTok star?
Well, I think like some of it was by happen chance. So my like chief fellow year, I was actually, my wife and I lived apart, so she had the kids there. She's already practicing in Southern Louisiana. So at first it was more like F-boy antics, right? Like I love the like anonymity of TikTok. I was like, I was anonymous. Nobody knew me. So like on every other social media handle, it kind of goes back to you and your name. And so like, I love that. I got to be right-brained and kind of, you know,
creative.
I believe in like, not necessarily indulging, but like tapping into these little like, you know, frivolous whatever. So that's what that was. It was like more antic based stuff. And then for whatever reason, it started getting a little viral, started getting like, you know, a couple thousands of followers. And then in Eastern culture, we have this like philosophy of like balance. And I see like you have bad eye and everything around here, right?
I've got lots of like crystals and shit.
Right. But it's the same. And I believe that like there needs to be a balance of everything. So if you get a lot of attention or a lot of like, oh, good job, or this is great, that's like unhealthy. So you got to kind of balance that out, right? With something else.
Yes.
And for me, it was like, well, shit, I have like all this knowledge on stuff that's not really easy to find on the internet. I mean, it's digging through just a humongous pile of crap. So I was like, well, let me just start at least, you know, trying to benefit in some way. And so I started talking about like cancer screening, and I was like, that's the very least we can do. Even if I got like teenagers that are watching this, they can be like, Mom, Dad, did you get, you know, that probe put up your butt or whatever? Because there was I think there was a doctor, he says he's one on TikTok that says you need a colonoscopy.
He's dancing, but he's cool.
Well, fake being cool. Yeah.
Oh, whatever. So that was kind of the motivation, was like, okay, I can help give back to something in the world while also indulging in this creative side. And you marry those two things together and you get on like I said, the wellness/health side of TikTok, and it's like a masterpiece.
That was the hope. And I so that it's cool because it's recyclable. So like all this stuff that I like, you know, would say at parties or my friends' parents or whatever, I'm like, now I can just recycle that information. So the same stuff I'm even telling patients over and over and over and ad nauseum, I can now spend better time with them because I'm like, hey, check out these videos. This is where, and my YouTube's a little more serious. Like I don't dance and all that stuff, but like, then it's just accessible. And unfortunately, people now need to like have that information to bring back to their doctors sometimes. And it's not just the doctor's fault. Like it's just everything's changing too fast, and there's all kind of like independent little things that make it challenging. And you went through that.
I was gonna say like a conversation that I have with my friend, but she's a founder for oh my God, what is the word? See, I'm like so nervous you're here because I'm like so starstruck. It's a virtual reality heart rate variability trainer for chronic pain and illness. And she was talking about how in like when you go to school, you have to pick something. And it's like you fucking learn every single thing about this one thing. You become an expert, like the top person in this one thing. And then it's like, yeah, but what about the whole body as a whole? And like maybe in Eastern medicine, you know, like you treat the body as a whole. And so I think in medicine, the problem is that we have these specialists who really know one thing really well, but us as patients don't know even that the body's supposed to be treated as a whole.
You're absolutely right. I mean, like we're taught in like, no, you are. And we're taught in algorithms, right? Like, so we know how to do what we specifically have trained in, but the collaboration is really lost. And part of that is because everything's evolved differently. So you have the science part that evolves. You have, you know, big pharma that like is releasing data. And then you have this bureaucratic pressure from insurance companies where we have to, you know, write more things. Like I have to say 3 things about your heart physical exam now, or otherwise we can't, you know, bill. And so you're using up all this time at work more and more and more week to week. So then the doctors can't spend as much time in the patients because they won't get recovered. So it's just everything's kind of a clusterfuck. Like, everything's like that. Yeah. And the person that suffers is obviously the patient most. So at least on the education part, if we could just bridge that with this kind of like relatability, it's just necessary.
Well, that's what I was going to say. That's so lovely about what you're doing, because you really do make it feel like not only am I your friend, which there's already kind of like a power authority complex when you're visiting a specialist too. It's always like a little intimidating, and some of the specialists I've seen do not have like the coolest bedside manner, but that's what you trade when you go for brilliance, I guess, right? But like you also are helping point people in the right direction early on. Like when I saw the one that brought me to you, which was about like you were like, do you have, I'm going to do a pointy thing like I'm on TikTok and you can't tell unless you're watching this, but it's like, do you have fatigue and restless leg syndrome and this, that, and the other? And I was like, yes.
That
yes,
was
I
the
do.
one where you were like,
yes.
oh my gosh, like I think I need some help immediately.
I was like, I've never, of all the fucking shit in my life, and I know, you know, listeners can relate to because they're young women mostly, is that, you know, we feel fatigued, we automatically get put on an antidepressant, we aren't asked about like our diet or, you know, our medical like parental history. You know, it is a lot of like throw medication at the problem,
right.
And you give this, it was just like a light bulb moment for me where I was like, oh my God, I never looked into like my B fucking 12. I don't even know what that means, but you're giving us that like jump starting moment rather than going like, oh, I'm kind of stuck this way forever.
Right, exactly. And that's the hope, because there's tons of people that sure are taking a medication to help stuff.
Yeah.
But then there's tons of people that aren't given medication and they think it's normal to be fatigued and maybe some of these things that may be explained very simply with like iron deficiency or B12 deficiency. And now that, you know, in this day and age, you get your labs and stuff. So that's why I go through and I'm like, hey, if these three things are like looking kind of shady, this may be something you want to ask your doctor. Because I mean, doctors make mistakes. Like everyone makes mistakes. And some of them, it's me telling you as a hematologist, as a blood specialist, where a primary doctor that's really busy trying to meet the needs of the community just may not know that or be able to recognize that.
That's so beautifully put.
But
doctors are just meeting the needs of the community. Like politicians, you work for us. No, doctors aren't like working for us, but...
I used to think when I was training, I'm like, oh, the doctors that are, you know, really busy and not paying enough attention, they're just trying to make a lot of money. But I quickly realized when you're in practice, there are most places other than big cities, the need is so big that as an oncologist, if I'm not seeing X number of patients, people aren't just getting their cancers addressed. Like there's still 2 to 3 week wait to see a cancer doctor with a diagnosis.
There is.
And that's lost time. So like they could say, well, you know, all the doctors should spend more time, and they should. You are entitled to that.
Wow.
But the circumstances make it such that extra time means somebody doesn't even start treatment now.
Wow.
And it could go from a treatable, curable stage to spread. So, you know, it's way more multidimensional. That's not to say that anyone is innocent or benign on the doctor's side.
No,
it's not that too.
We're not anti-doctor here, as much as like the audience has probably heard me complain about my experience with Western medicine. I also totally understand we're like the most privileged founding, I don't even know, all the F words that make America so fucking good. But I do think like there is that lack of understanding exactly kind of what you're talking about with the symptoms being considered acceptable and normal. Like I don't ever remember being taught how to like take care of my body as a teen in public school besides like sex ed, right? You're like, girls, you're gonna get your period, and guys, your hair is probably gonna fall out. And you're like, okay, but what if I'm fucking tired all the time? Like, oh, you're just a teenager. Well, what if I bruise really easy? Oh, you just are like rambunctious, or like, I don't know. I feel like there's that lack of also our own bodily connection and awareness. Like, are you at all spiritual in the sense of like mind body practice? Like,
oh, absolutely.
You kind of have to be, right?
Yeah.
When you do what you do.
Well, yeah, I mean, yeah, especially with cancer, yeah. But I mean, that's why, I mean, I'm not, to no exaggeration, like that's why people like you inspire me, because you have perpetuated, like, you're very open and candid about, you know, what you've been through, and then how like it's still, even though it's somewhat controlled, sometimes it's not, and all that stuff. And now people feel like vindicated because they see you and hear you and say it's okay to, one, want better optimal health and control of whatever is going on with me, and two, like to seek out and to make sure that everything's been appropriately investigated. And it's sickening when you know that like that's usually not the case, and people live 30-40 years. like someone's anemic or iron deficient because of their periods, and like if somebody's not correcting it and just saying that's normal, which it's not, you're not supposed to just ride out an anemia for 50 years. Like life's gonna get good for you after 51, after menopause. Like that's not right.
Everything's gonna get worse.
Right. Oh yeah, exactly. Then everything shuts down.
Right.
So these videos should say like, hey, that empowers somebody to say like, actually, I'm not supposed to be anemic, and they go seek out to like be sure that their iron deficiency is repleted,
right?
So that they feel better.
Yeah. And I saw like a comment that someone had watched your video and was like, okay, clearly I need to go get my blood tests run, right?
Right.
And that's even what I said to you. I was like, okay, where do I go and what do I do? And someone was like, oh, I want to go see is a hematologist or an oncologist? Okay, sorry. I went to no college degrees here. And they were like, but I don't want to take up the time of a doctor who is treating rare blood disorders. Like, is there a middle ground between feeling like I deserve to be taken care of?
No, absolutely. And that's what I did primary care for a while as an internist, and that's the quarterback. That's the one that really says like, can I comprehensively evaluate this on a primary level? And then if something's still not explained, that's where they like toss it over to the expert. So at the end of the day, it's just very important for people to just feel that they can get answers and at least have it explored. Sometimes peace of mind, even if it's like, unfortunately, it's not the reason for your fatigue. That in itself is comforting, because you can say, at least I've been looked at, instead of this thing just kind of like sitting in the back of your brain, like, am I missing something? Even that's peace of mind.
Well, you feel like it's your fault. Like when you're still in pain and you're still, sick or whatever, you feel like no matter what you're trying, if you're not feeling better, it's your fault.
Right.
Not like, oh, something's wrong with me medically or chemically or DNA wise. It's like, it's because I had that Kit Kat bar. Oh, it's because I ran into the side of the table, or like, it becomes a very exhaustive process to try and track down something as unique as like blood disorders. Right.
And the number of times I've had a comment that said, I'm not trying to blame, but they'll say I was told it's because of my weight or because of whatever. And they're like, because of your video, I started on iron supplementation. I was iron deficient and it's all resolved. I've gotten so many of those now. And
that never gets old?
And restless. Oh my gosh, no. It's so rewarding. That's the whole purpose, right? Like, it's like you've changed the trajectory of someone's quality of life with a fucking TikTok video.
Oh, bitch.
I mean, and that's when people should professionals be on TikTok? I'm like,
what?
Why? Like, why not? Like, what I'm sharing is not what's not already on the internet. Yeah. But to make a patient just have to sift through all that shit with no medical training and figure it out, at least make it more streamlined.
Yeah, we don't know the fucking definition. The words that the medical journals and shit use, and I have sat there and read through medical journals.
I know you
and
have.
Fucking like test
COVID
experiments. Yeah, Jesus, clearly.
Dr. Fauci.
Yeah, right. If only he could come on this podcast. He went on the Try Guys podcast, so maybe there's hope. But yeah, so talking about like, assume you're talking to like a relatively cool Gen Z / millennial audience of, I think we're like 90% women, which like fucking proud of that.
That's awesome.
I know, right? I'm like, I've never been 90% anything, let alone all pussy power. So we talk about blood disorders. I know you mentioned periods, and I was like, oh my God, I didn't even think about that. Could that be something to do with like your job, or like, what can we talk about that's a little bit overarching of people that are listening to this podcast that might have those symptoms, not knowing that it could be related to blood stuff, without also freaking people out and being like, you probably have blood cancer.
Right.
And you're going to die soon.
Right. It's funny you say that, because I get referrals about that. And I had this kind of backwoods country guy, and he was just like, man, he's like, it was totally benign, meaning it wasn't anything cancer. Right? It was. And that's what he's like, man, he's like, the last 2 weeks, I've sworn that I was going to die. Like, I knew I had lymphoma and this and that and the other. And when I told him everything was fine, apparently he came to my front desk like 3 or 4 times asking me seen sooner. I didn't know. Oh. And then when I told him, I'm like, dude, it's fine. Look, I repeated it. It was a blip. Like, your lymphocytes always kind of go up and down. He had this big sign. It's like, maybe this was all celestially, ordained. Like, you got to be nicer to people. And really, politics aren't really that important at the end of the day. So I knew he was the guy that was probably just arguing all through 2020 about whatever. And he was just like, I think it just taught me that it's really not that big of a deal.
I'm a wake up call, and I'm not voting for Trump anymore. Like, right? That guy's
That's
life.
What he seemed like, and
oh man,
it was awesome. It was endearing, but yeah, being in the face of something like a cancer diagnosis was really scary.
Oh God.
But to answer your question, I think the biggest thing, especially like 90% women, which is just so awesome and is really what made me think about doing OB-GYN for a while, because I feel like for whatever reason, women really are more proactive about their own health.
Yeah.
And, right.
We're louder about it.
Well, and they're just respecting each other, like self-respect more and everything, to say like, I deserve to, be, I think it's a generational thing. I don't know that it was like that.
No.
Especially in the South, 1 or 2 generations. You just dealt with shit.
Oh, yeah. You're just like, I just had one leg my whole life. And you're like, what? You never got that checked out? And it's like, that's just how it was back then. You're like,
right.
Fuck, you guys also didn't like get to vote for a while, but we changed that. Like, things are changing, you guys. Yeah.
That's exactly right.
I think women are fed the fuck up. And
right.
I mean, like, we still know there's a huge disparity in like the way women of color are treated in the medical industry. And like, I completely think that it's amazing you even gave thought to that.
Oh, like, I mean, absolutely, yeah. Like,
I don't think people think doctors do that. I think people think doctors are in it for like the God complex and money and like Grey's Anatomy, right? Like,
no, that's just surgeons.
You heard it here, Shonda. But yeah, I think it's really fascinating what you were just bringing up with like this being a woman mainly listened to podcast and like what is valuable for us to know coming from someone like you.
Yeah, so I think the one main one that I see on my comments all the time is like, I do have fatigue, I may have restless leg, I do feel like short of breath easy, this and that. And the big thing is a lot of primary doctors will look at your labs and they'll say you are not anemic. Now, or you're anemic, but you're quote unquote run that way, or that's like your family runs. It is never, let me make this clear, it is never normal to just be anemic.
Okay.
You need to have a reason for your anemia.
What does anemia mean?
Great question. So anemia means your hemoglobin, or like the concentration in your blood. So when you say blood, it's actually it's platelets, white blood cells that fight infection, and red blood cells. But to the lay person, when you say blood, you're thinking about the red blood cells that carry oxygen.
I was thinking about red water that flows through your veins, but
that's it. And so that's what I think that's the lay term of it.
Yeah.
And when they say that you're anemic, that means your hemoglobin, like that thing where, Hg or Hb or hematocrit are low. So like that's anemia. That's all that is. Anemia is not a diagnosis. It's just like more a observation. You are anemic and you need to figure out why you are anemic. Why is your hemoglobin low? Right. Or your red blood cells in another way to put it. So a lot of times doctors or whoever or family members will say, oh yeah, we run anemic, or we, but that's not normal. Now, with that said, it can be genetic, but you need to have a diagnosis. What is it? Is it thalassemia that's making you anemic? Is it these other things? That is a genetic mutation. Okay. So it's possible or sickle cell. Have that. Yeah, but you need to have that. Yeah, you need to test it. That's a genetic mutation. If you're going to say that somebody's anemic because of genetics, you better identify that. That needs to be identified. You shouldn't just run anemic. Yeah. Okay. And what happens is a lot of people are labeled anemic, and really what they are, especially women that are having cycles, they're actually iron deficient, which is causing their anemia. So iron, iron is like the bricks to build a house. Okay. And the houses are the red blood cells. So if I start running out of iron, then I can't build enough houses. Right. Easy. Now I'm anemic because I don't have enough houses. Oh, and there's holes in your house. That's it. And that's where bruise shows up, is where the hole is? No. Okay. The bruising's not involved in that part as much. Okay. Yeah. I didn't know that. I thought anemic meant you bruise. No. It just means that your blood is low. Oh. And that's where people deserve, so that when this thing about fatigue and shortness of breath, they deserve a workup, because if your iron, so the size of your red blood cells, if anyone looks at MCV, if it's small, if it says low, that means that they're abnormally small. The houses are too small. Aww, and you got to find a reason. You got tiny blood? That's it. It's tiny cute. Blood, and it's so sad. Oh, it's sad. And let's make it better, because you give the iron, and those are the bricks. And iron, this is going to be a loaded question. How do you feel about supplements? Oh, I mean, I think it's totally appropriate when... It's way too loaded. You can consider anything a supplement, right? You can supplement your life with cocaine. Listen, I did for quite a period of time, and it didn't do so well for me. Or my anxiety. That's very funny. Okay. I do think it's dangerous to just so what was scary, and this is why some doctors are cautious, when I post these things and I say, this is why you should see if you are deficient on iron, a lot of people are saying, where can I get my iron supplements? I'm like, I didn't say like go supplement. I'm not saying that is the reason. I'm saying you got to first see if you are deficient.
Be careful about that.
Yeah, because there's other reasons you're anemic. Yeah.
Right.
I'm not saying that's what you have. I'm saying you need to see if you have it. And then that's where it gets dangerous, because if you have enough iron, then you don't need supplementation.
Then why would you have anemia if you don't have enough iron?
That's why I have to go to school for 15 years.
So you can't just tell it to me and I can just know?
Well, B12's one.
And B12 is not iron?
Nope. Those are two different things, and they're different bricks. So you need B12 bricks, you need iron bricks, and you need folate bricks. Those are the three main things.
What's folate?
It's folic acid. So,
okay. I know what that is.
And those three, that's why it's important, very important to take your folate if you're pregnant or even trying to get pregnant. Because you need a lot of this to make the brain development and spinal cord development. And he would know.
He has 3.
Yeah, exactly. So take a folic acid.
Women. Feminist here.
There you go. Big time, actually.
Good.
Because I see a lot of that, like with my wife. So my wife's like blonde, blue eyes. We're the same 3 specialists. She scores top of the boards, and she gets treated so differently, by other providers and nurses and stuff than I do as being a half attractive male. And it's just so unfair because we're the same, same exact stuff. So that's where I really started becoming outspoken. That was actually the first thing I talked about on TikTok.
I like that. You're good. See, you belong here.
Well, I like I said, I'm honored. I find all y'all inspirational.
I never am like, I'm sure the confidants notice. They're going to say like, I'm never this fumbly and like, I never forget things. I'm just so intimidated by like,
why? No.
Because you have this ability to change someone's life. Like, I think I'm like envious in a way because I wish I could just know these things so I wouldn't have had to suffer for so long in a weird way.
Right.
Not that I'm saying the problem is my blood or whatever, but there's just like, I guess that's why I have like a authority complex with doctors anyways, is because I'm just kind of like, you're supposed to be the one that helps me. Right. And when the person that's supposed to help me, the specialist, the best in the world, Mayo Clinic, the UPenn guy, like doesn't help you, you're kind of like, where am I supposed to go? What am I supposed to do? And you become your own advocate and you get a little like, so I just think what you're doing is like really fucking cool. That's all.
Well, we're doing this together, and that's what's so cool. Like, it's all collaborative now, right? So like, I have the knowledge. Anyone can do that. Like, it just takes a number of years, and then you put yourself in a position to like assimilate or like disseminate all this information,
but also assimilating the troops.
Right, there you go. To everyone. So like you're literally assisting you. If whoever watched this may be iron deficient or B12 folate. So B12 deficiency, if you're a vegetarian, you should worry about that because you might not get enough B12. Yeah, and that usually presents with like numbness and tingling in your hands and feet.
Okay.
And tiredness, fatigue. And if you're anemic and you're vegetarian, you should definitely at least hope that your doctor had looked in to see if you're B12 deficient.
It's a question. Maybe I should have asked this first. Should you be ever getting like blood tests and labs done just at some point in your life? Like, shouldn't that be a standard ass thing that we do?
It is though. It's that's why it's covered by insurance. Like you're supposed to get annual labs.
Oh, what?
Yeah.
Annual?
You don't see a doctor annually?
Okay.
Your annual
when they say
every insurance policy covers that.
When they say who's like your physician, I'm like, I don't have one. I have 1,000 specialists. I'm going to my gyno every fucking month because of my pussy problems, but like I definitely don't do that.
Your quarterback, your primary doctor, family medicine or internal medicine, you're missing your quarterback.
Dog.
And that's your quarterback. That's the one that like dispatches everything fine, that keeps up to date with the OB-GYN, keeps up to date with surgery, the rheumatologist, pain specialist. That is your primary. That's the dude in the corner in the boxing ring that says, all right, now we're going to go back in the ring and whatever. That person, he or she is supposed to just like, be with you in the whole process.
So I'm a 30-year-old woman and I'm clearly, I was going to say very smart and successful and I don't know that I was supposed to have a quarterback.
That's impressive.
No, it's not impressive. That's bad. Like I'm probably
just like, fuck everyone else. I don't need one. Like I'm going to make it even
I always
better.
thought I was skipping steps. Like I was always like, this guy's just going to refer me to this person and like whatever. Okay. Well, speaking of all these things, I don't know if any of this is useful to you, but I pulled out the things that I found in my medical. I've had so many surgeries and fucking things and shit like that I could not find my fucking blood type. I don't even know. These say lab results and they say the word blood on them somewhere. Blood. Is that?
Yeah, it won't show your blood type.
That blood? Is any of this useful?
It's useful. So this is a big thing though. That you want your annual physical exams and your annual bloods if you can.
I don't
because
think that's
it can discover so much stuff, and
so
that's
you
where
could have looked at this and been like, oh, you're probably this.
Anemic. Yeah, like that's a big one. And so again, like anyone that's having cycles, like you should get annual labs, and if anything's low, like you should inquire about it because it's never
not
normal.
See, I'm pretty sure these are from like I did a hormone test because I've fatigued. I wrote about this in my book actually, that I slept so much of my life. Like I was fatigued, and people would just be like, you're a teenager, you're overactive, like you're doing so much coke. Like I just thought I was sleeping because that was normal, and I didn't realize how much I was sleeping was abnormal. And so finally I went to go see someone to be tested for Hashimoto's because it runs in my family, but it didn't show up. And so I just thought like, okay, nothing's wrong with my, is that
thyroid.
Mm-hmm. And so I just like never went back to any of those doctors again. And then I saw a acupuncturist who made me eat a clove of garlic every night.
How was that?
Really rough. But honestly, when you said the tingling in my hands and feet, I used to get that. And after I started seeing him, he would put like muckwort on my leg and burn it and then do acupuncture through it. And after like 2 or 3 sessions, my shit stopped going numb and my toes stopped getting cold. And then I was like, okay, this guy's clearly a witch. And then he fucking had to move back to Korea because of the COVID. And now ever since I stopped seeing him, my fucking feet go tingly again and my toes are cold again. And I usually am someone who's kind of like, okay, if you believe it, you see it, you can dream it. Like I can manifest any symptom into my life if I really try.
I mean, the mind is really powerful. I think
agree.
It's not respected enough in the Western world.
100%.
In your head, quote unquote, it's not something dismissive. Like the mind is the most powerful of anything, and it can cause very real organic problems.
Yes, and I think people live in that sickness too because they get in their fucking head and it becomes their entire identity.
Yeah,
we can sidebar about that like for a very long time because I'm starting to write my second book about chronic pain and illness, and like I'm wondering how much of that to include without completely dismissing the entire body of people. I just need to be better with my words. Okay.
Go back. I need to piggyback on the pain thing because the pain, I'm glad you bring that up. Pain, to anyone listening, remember, it's the only thing we can't measure, quote unquote, objectively. Ooh. So I can put on a heart monitor and see what your heart rate is. I can see how much you're breathing, your oxygen sats. And they'll always say, what is your pain level? And we'll never be able to objectively measure it.
That's so dumb.
But it's important because, and this is how one of my cancer professors told us. He said, all of us, especially if we play sports, you're an avid, prolific skier. You get bones and groans, right? Like in your joints and knees afterward. I'm sure you're hurting today.
Yeah, sore.
So imagine that same pain you had in your knee, but when you went in and say you thought you got hurt it and you got an x-ray and it turned out to be a bone cancer. Oof. That was cured. They cut it out and you're cured. How are you going to perceive a similar ski pain in the future?
Your cancer.
It's going to be, but it's going to be exaggerated. That pain is going to be way more distressing and debilitating, not because you're just fucked up and making it worse.
No.
Your perception is going to be heightened.
Oh, yeah.
And so that's where pain gets complicated. It's not necessarily the fact that you tweaked your knee skiing. It's not the actual event that happened. It's the perception of the event and how it was affected in the past.
I never thought about that.
Yeah, and that's why people shouldn't be so dismissive of pain because like it's extremely complicated, and people in like Eastern, like or all over Europe, respect it so much more, and the whole kind of like headspace, mind space, play. And here it's just like a little, I would say, and I might get some crap for this, but I think it's dismissed a little too quickly.
Well, I also grew up in the opioid capital of the fucking universe in Florida, and so I got to see like what was the way that we treated pain and how children are getting hooked on this shit. Whatever, total other side conversation. Sorry, I just burped. I'm drinking a sparkly soda. But yes, I want to pick your brain more on that because that is such an interesting thing that you just said. But I wonder if it does also apply into what you do. And I've always wanted to ask this question. I had to ask my gynecologist this once because I was just like, I couldn't keep it in anymore. I was like, you have to tell people they're pregnant without them knowing it all the time, right? And she was like, yeah, like every day. And I was like, what is that like? And she's like, it's not always smiley moment. Like sometimes it's like, this is a bad thing for you. Yeah. And so do you have to deliver bad news, and how? And do they teach that part of like the psychology of it in med school?
No, they don't teach it.
They don't?
Not
That's fucked up.
Not head on.
That's like sending you out
so
to
not
war.
in med school. Like in fellowship, like if you're specializing in what I do, like cancer, then yeah. But yeah, I mean, I get bad news on a daily basis, unfortunately. I have to tell people, I get very close to people, right? I see them sometimes every 2 to 3 weeks. I like know them, their families, we know the kids.
Oh,
and then they progress or they went from like a curative stage, they enjoyed a remission, and now they're metastatic and they'll pass away in a few years. And that's hard.
Jesus Christ.
It's hard. And a part of you sometimes even feels guilty, even though you did everything that was standard of care, gold standard. But no, I mean, that's on a daily basis. I have to do that. And that's really,
God.
yeah.
What's your sign?
Gemini.
Oh, how do you do that? Well, I guess because you're Gemini.
Yeah.
You can turn
I have
on
one
the
side,
doctor.
yeah, and the other one I have to balance.
I'm Gemini moon and rising, but I'm a Leo sun, just in case you cared. Wait, but
I
so
see
like,
that.
thank you. I'm assuming. How do you...
A Leo would say thank you.
Yeah. I'd be like, yes, and. How do you fucking deal with that? Because if it's something with your blood or oncology, I'm assuming it's not always a happy conversation.
Right.
And it's like, you were talking about how even though you did everything you can, and like I'm sure that's something you have to tell yourself to survive.
Yeah.
Like, how do you take care of you? Like, how do you self-care? How do you survive in that world?
I mean, the biggest thing, and I think it's making sure that I'm doing things with the best sincerity and compassion I can, because that's protection for me in the future. So that's what a lot of my YouTube channel is, and a lot of my oncology teaching is, because unfortunately, these patients are going to have cancer whether I'm their doctor or not.
Yeah, it's like not your fault.
Right. And they're going to pass away in 2, 3 years, 5 years, whatever it is, whether I'm their doctor or not. But what I want to do and influence is, did I make that easier? And I get that reinforcement all the time. There's nothing more emotional than somebody saying, like, when you say, I'm sorry, I think it's time for hospice. I can't, in good faith treat you with another line because it's just going to make you sicker, and I want you to enjoy your life and your family. And then when you give them this terrible news, like when they say, doctor, thank you deeply, like that's when you feel like I want to cry, because like they're thanking you for saying like, this is the end as far as, you got months left.
Yeah.
But it also at the same time kind of like validates like, their trust and like appreciation for what you did. And that's the big thing is like, how did I always say this, there are so many patients sometimes I see as a second opinion or see on things where they've been enjoying a pretty near complete remission, even though they're stage 4, which means incurable. Wow. And they're, have a near remission for 2 years, but they don't know a thing about their cancer. They don't know, they don't know when to come back. They don't know what to expect. And so those 2 years are pretty shitty for them.
Right.
And then I'll have patients that are pretty advanced stage 4 that I can give a year, but they're happy because like even though it's half the time, they know what they're in for. I'm saying, I want you to have these good days. I want you to really enjoy them. And I was like, I'm waiting for you to tell me, doc, I can't come for my treatment because I'm going to the Grand Canyon. I want to hear you say that. And so when they're like that, I'm telling you, and I'm not just saying this, and it's like people like you. What's that?
I'm like trying to keep it together over here.
Well, it's just like people like you. I've been so humbled by seeing what quote unquote everyday people, the strength and courage and amazingness that can come out when they know what they're at face for.
Right.
And that's what humbles me.
Education is power.
Yeah, any person can overcome anything if they know what they're in for. It's fucking terrifying to go into the water with your eyes closed.
Yes.
But if you let yourself open, like you're just gonna learn to like navigate. And that's why like it's hard. How do you do it? I'm like, dude, are you kidding? It's so humbling because I see this like inspiration in my patients every fucking day. I'm like, I can't believe you went and came in here so scared and you have just fucking owned it. And you're just like. It's incredible to see them just grow.
You have me comparing every doctor I've ever seen now to you. I'm like, this.
Well, you deserve that.
Well, he did. Like, the times I didn't get explained or I got dismissed or genuinely laughed at. Like the times where I've come in and been like, I know this to be true. Like, here are my facts and truth.
Right.
And to be like dismissed or put down or are uneducated, it's such a fucking emotional thing when it comes to health. And like, I know I've lashed out because of bad pain days or like I've not been myself because of it, but the thing I think I'm like learning right now really strongly is like how much the relationship between you and your doctor is, because if I can't come to you and even say like, I feel nervous around you because you're so famous, like how can I expect you to see me my most vulnerable and celebrate like the biggest wins with you either? Like what advice can you give to people about like when to trust your gut on a doctor?
I mean, it's just vibes. It's the same way you would feel about anybody, you know, like
vibes.
If you don't feel good, I just think, I think listening to your gut is such an underappreciated thing.
Because it's your second brain.
That's it. It's true.
Really
that's a whole other topic.
That's a whole other episode.
That's a Pandora's box. But you know, and sometimes with decisions, when I'm like, should we treat, should we not? I'll say the same thing. I'm like, go with your gut. If something happened with this, would you say I knew I shouldn't have done it? Ooh. Or would you say I knew it was the right decision? It sounds so simple, but same thing with the doctors you're seeing. If some reason in your gut you don't ever feel fulfilled or satiated,
yes, find
another one. Like it's not you're not firing, you're not anything, like you just don't have that vibe or reassurance. Because like I said, there's nothing more important than just knowing, even if the answers are the same. If the doctors tell you the same thing, there's an answer in either case. But if one still makes you unsure that you were worked up and the other one really makes you feel good about what happened and the answer was the same, your quality of life is so much better between those visits, even though the outcome was no different. It was just how it was explained.
Oh my God, I wish I could put you on my back and take you to fucking UCLA right now and
like
talk to some motherfuckers. You're really heightening my standards right now.
But people deserve that, you know? And honestly, if you vocalize that, I really do believe. Look, I mean, there's bad apples in anything. Plumbers, like politicians, whatever.
A lot of politicians.
So I hate, not all doctors are the same, but like, but I would like to believe, and not just in doctors, but I believe that's about humans. Once you kind of cross that line and say something like, I really do feel uncomfortable with this, or would you mind going into it more? I would like to think any human being that's not a, sociopath, would really say, forgive me. And even if he or she is jerk, whatever, I would think change their tune, because sometimes they just need to hear that. They don't know. Yeah. They may not know.
They just need to see your humanness too, I think. Because I know whatever.
And if they don't, fuck them. You go to somebody else.
That's what I'm saying. Yeah. I go in literally with a script, because I've had to tell the same fucking story so many times, so many medications. And I literally go in and I feel just that, that tightness right before you cry. Like I'm already like this talking to a new doctor, and it's a vibe. Like it's exactly what you're talking about. Yeah. They're either like, oh, it's okay. Like they either see me as human, or I see them I think I've been treated as like a number to a lot of people. Like I've had doctors forget my name, forget like what they put me on, like many times where I've been like, you don't remember what the fuck medication I'm on? Like, yikes. I've had my favorite doctor die on me. Like, what an asshole. Like, you guys can't die. You guys have to live forever. The good ones need to stay around. Do you check yourself labs wise when you're like, I'm tired right now?
Not as much as I should. And you would think, like, me being a blood cancer doctor, like every now and then I'll just be like, I'm probably a fucking cancer. Like, I'm just gonna have to roll with this and reevaluate next week. Like, so there are those moments for sure. Oh yeah.
Oh my God. How do you take care of yourself? Like your family? Like, how does your wife feel? Like, are you guys the healthiest or most hypochondriac in the best way? Like, are you over healthy?
No, we're definitely not. We're not these like I wish we were. We're not at all like these like obsessed
you do look
like
good
good like habits and stuff.
Like with this outfit and hair, sir. I'm finding a hard time not believing that your life.
I primped a lot before coming here. I knew
you were cruising around in Santa Monica today, right?
Yeah, it seeps into your skin.
Yeah, you're just like LA vibes.
That's
like,
it.
Yeah,
that shit will wash right off by the time the plane touches down.
No.
But no, not super healthy or anything. Like it's just. Yeah, you do the best you can kind of thing. Because, like, again, especially being an oncologist, like, we're all going to die at some point. So, like, you don't want to do anything that's reducing the quality of your life to maintain, like, an extra day or month or year in your life. But
that's a good way of putting it. You're very poetic, I think, without even knowing it.
It's weird. I don't know where I got that from. Like, I studied philosophy in undergrad, but I think
that's it.
There's just so much but there's so much end of life stuff in my everyday life. I think that's what it is.
That's beautiful.
You just have to get in tune with the bigger picture. Otherwise, it will eat you away. I
really like the idea of like whoever I'm seeing that's helping my life quality of life being a bit of a stoic, because I think you do have to have this. There's no perfect way to live, I think, and especially you add something like a genetic disorder or a lifestyle choice that's made you less than perfect. Like, I just want to see them as human too, a little bit. I guess. Yeah, and
you deserve that. That's the biggest message.
What do you mean by like we deserve that?
You deserve to feel heard. And if you don't feel that way, like that fundamentally really should be the primary purpose of your physician. Like I said, we're all going to die. We all could have a health problem. Somebody could catch it. Somebody could not catch it in a month. But really what matters is, do you feel taken care of? And if you don't, first, I would suggest expressing that because like I would like to give the benefit of the doubt and think that, you know, people gave up a lot of years of their life to do something because they want to help people. And if it still doesn't jive with you, then go seek out, you know?
Yeah.
And that's not necessarily that there's an answer that's got to be there. It's not necessarily that, but do you feel that it was evaluated properly, and do you feel heard and seen?
Right. Well, I think like, again, I think the way to also break that is I'm starting to see younger doctors. Like I had old dinosaur-y skeleton, like he's the best in the and I'm like, I'm sure, but he literally can't remember my name. Is he the best? Like, I don't know. My other doctor, my favorite doctor, died of a he died of cancer, quick cancer, which made me go like, was he taking care of himself? Like,
so though that really bothers me.
Why?
Because everyone, like, that's not everyone, but I was shocked how many people think that cancer means you had to have not had healthy, like that. People think cancer can't affect healthy people,
or like doctors, because you're
or
a
doctors
doctor.
or whoever. But that's completely false. Now, bad habits can make you get cancer. Certainly, like smoking causes lung cancer.
Putting the computer on my ovaries.
I worry about that.
I did it on your ovaries.
On my ovaries, you know, they're gone now. What
happened? Wow, cancer. No.
But no, like, so you can do like, you know, and I drink. Ideally, like, does any amount of alcohol probably increase your chance of some cancers? Yes. Like did I say ideally? Theoretically.
Ideally.
No, not ideally. Theoretically, they do, but like, it's not enough, like I said, for quality of life for me to never drink.
Right.
But the data shows that no alcohol is better for cancer than alcohol at all.
I don't know if you saw that. This was done in 2017 when I was probably at my
Why would you
peak
get that
alcoholism.
done?
It was for a BuzzFeed video.
Oh.
And so I literally
Are they short or long?
They are so short. My body thinks I was 38 years old when I was 27.
I'm sad. I hope that's a not data supported measurement that you got.
This is the guy. This is like the one guy in Los Angeles who has the fucking, I don't know, the test to do it. Like, I've obviously looked a lot into telomeres.
Maybe it was measuring your wisdom.
Oh, thanks. In that regard, I got a fucking lot.
But
this was also when I was at the height of my chronic pain.
Okay.
I was at the height of my drinking. I wasn't using, but I definitely wasn't healthy.
Right.
But I was devastated when I got these results because I was like, oh my fucking God, that's fucked up. And they were like, yeah, but you can regrow your telomeres.
Can you? See, I didn't know that.
Apparently.
Oh.
And so I'm sober now. Wow. I feel the best I've ever felt mentally. I can't say physically because like all the fucked up shit. But I do feel like this test kind of woke me up to a way of going like, oh shit, I need to start taking care of myself. That's same awesome. Way that I think like the test you do for people could really be like, here is proof in your fucking red water that says you need to be doing this or stop doing this. Like,
right.
Is there, I mean, like I keep going back to like just how much that one TikTok I saw of yours changed my idea of like the care I should reach out for or what I should look into. Like, do you have more like good
nuggets?
Juicy
we call them
shit?
nuggets.
Yeah, give me some more nuggets. Like nuggets of just like.
I mean, like I said, the blood work, the annual blood work that any insurance company, right?
Fucking Dr.
Like,
Kelsey.
let me just knock this again. No of it. But those are screening labs. So those are things that show us like, is your liver getting funky? Are your kidneys getting funky? You wouldn't know any of that unless you got the labs done, right? So it's a really good, like it's one of the first signs of maybe some end organ stuff that you can get on top of, like damage wise, before it becomes a problem. So that's why the annual labs are important.
Yes.
And then from the cancer side, it's so important. So understand that the reason cancer kills you, a cancer cell, and I'm not sure everyone knows this, it was your normal cell. Okay?
Oh, yeah.
It's not something like you caught in the air. Like, it was just a normal fucking cell of yours that has all of the same books on the wall, the same clothes in the closet. Everything is all your other ones. And then one thing switched. So instead of the light switch here, when we like turn it off, it's supposed to turn off. All of a sudden, that light switch doesn't work. So you can't turn it off. But the whole fucking room's the same.
Yeah.
So when people are like, oh, we had the cure for cancer, I'm like, it's literally the same as your other cell, just that one light doesn't work, and you can't attack that one light like that easily without killing everything else. And that's what cancer is. It's just something that got screwed up just in enough little idiosyncratic ways to where it either doesn't die when it's supposed to, or it's replicating like 10 times faster than it's supposed to. Like the turn on. Right. But all the rest of the properties are the same. And so the only way to cure it, which I guess cure is semantics, is to get it the fuck out before it goes somewhere else. Yes. How do you accomplish that?
I don't know. Chemo? Radiation?
Well, it's always surgery. Surgery's always standard of care. Yeah.
That too.
But screening. So the thing that really gets me is when I'm like, you should get when I was a primary care doctor, your quarterback, which you're missing.
Which I'm getting.
All right.
Tomorrow.
There you go. When I would say you need to get your colonoscopy, and they'll say why, and I'll say because we need to check, we need to make sure that you don't have or will get colon cancer. The answer I get, especially in Louisiana, is, well, doc, if I'm gonna have cancer, I'd rather not know.
What?
Yeah.
Who the fuck says that?
Oh my gosh.
You're like, bitch, I need to be employed.
That's surprising to you. I wonder how many. I would really be curious how many of your listeners would say, no, I totally agree with that, or people would be shocked.
What?
To me, that's a very common response I get.
Oh my God. I'm too obsessed with
maybe
myself.
It's too Southern.
Yeah.
And so, but what I tell them, I'm like, it's not to tell you like, man, you got cancer, you're fucked.
The end.
Instead, it's to tell you have maybe one fucking like little centimeter, 0.1 of cancer that not me, but a GI doctor could just snare off with scissors, and the cancer's gone. Versus letting that shit ride, quote unquote, and deciding, and then it gets in your bones, and then you're weak, and then you start to like whittle down. And I don't mean to be insensitive, because I know listeners, we have experienced family members that went through that. Yeah. That is a stage 4 cancer. Now, with that said, it's not that a stage 4 was negligent necessarily. We don't have anyone watching this would be like, why the fuck don't we just get imaging from head to toe every 3 months?
Why not?
Right?
Why not? Right? Is it too expensive?
One, it's would be wildly expensive, and so insurance is already expensive enough. But 2, it's also because then you see all this other stuff that ended up not being a big deal, and then you go investigate.
Yeah,
you put
we'd all become
in the pancreas. Like everyone is scared of pancreatic cancer, right? Because you're always told
that's it.
1, it's a really shitty cancer, and 2, you just never know till it's too late.
Right.
So anyway, with screening, get it out early. Get your mammograms, your pap smears, your colonoscopies.
Yeah. Okay. That's like that should be like the overarching message of this episode too. Is like you never have to see him if you just get your fucking screenings done and like advocate for yourself for screenings. Is that something that's
your doctor should like your unless you don't have a quarterback.
I don't have a quarterback.
Am I nailing this on the head enough?
You can't fucking throw me the football because he just doesn't exist.
Right. But yeah, so that's their job. Like they should definitely. So if you smoked for like 35 pack years or more, you qualify for low dose CT if you're still a smoker to catch that lung cancer early. Your primary doctor should be doing all this shit for you.
Wow. I didn't mention this because I forgot. My dad had stage 3. We just said it was bladder cancer, but it was like his urethral remnant cancer.
Oh, wow.
I know, it's really fucking rare. Yeah. And it's like the tip of his umbilical cord or something. Right. And they were like, we caught it at stage 3 because it was one of those things where it goes under the radar for so long. And then, men, they don't fucking take care of themselves. My dad was like pissing blood and was like, I guess I'll just ignore this until I can't anymore. Things like old men, the time. In their 70s do. But then also, Jared, my partner's mom, passed from breast cancer when he was in college, and he will tell you, like, to this day, it was because she did not get a chance to take care of herself, and she was the primary caregiver for his sister who has cerebral palsy, and so he really thinks like the act of every day you're basically living for someone else prevented her from taking that time to go get screened. People's jobs, they get busy. My dad just was ignorant about it. Like, I think there's so many reasons subconsciously we avoid it. And you're kind of like, no,
but I get it. I do get it though.
Yeah. Well,
it sounds, but like because I don't want anyone to feel guilty, especially like if they ended up with it or a family member.
No, but it's not their fault. Like you said,
I don't go annual. Like I should, and and I'm a doctor, so like I can't even. It's we are human,
right?
But again, with TikTok or these things, sometimes if you just see a video saying,
this
and like shit, like this is the God's just telling me again to like do my appointment. Like this, if you're watching this, this is one of those. This
is your moment,
right?
To get a quarterback and go get screened.
That's it.
And your paps and your mammogram. I mean, I've never had a mammogram. I'm 30. Is that abnormal?
You shouldn't need one yet.
Okay, I was like, I also have very small titties. I don't know if that makes a difference, but I feel like that could be part of it. But I feel like this generation is also going to be game changers for like screenings because who doesn't know someone who has died of cancer?
Right.
Like every fucking person is like, when my dad calls me, he's like, oh, Joe has cancer. And I'm like, who? And like, okay, not because I'm soulless, because it's just cancer became very like, you kind of are going to get it.
Yeah. What people say is if you live long enough, you'll eventually get cancer.
No. Yeah, what the fuck?
Well, because what's happening is each time your cells all replicate throughout your life. And every time they replicate, they get little errors in their blueprints of their housing.
Their coding.
You love my
I love your little no, it's totally
good. But they're blueprints, and so if you keep carbon copying, what happens? Like eventually, little errors happen.
Lazy.
Yeah, and then these areas get carried over instead of being deleted, and then over time, the aggregate of all these errors turn into this fucked up mutant cell that was normal, and then sustained a couple of bad mutations over the last 20 years. Yeah.
Okay, I can't believe we've been recording for 55 minutes because you're my new best friend and it's so easy to talk to you and I can talk to you forever and ever. And I know, I'm like, oh my God, I went from being scared of you to like, now I just want to hold your hand all the time. But I didn't get to any of the fan questions because I was talking about myself the whole time.
No.
Just, casual conversation. But I think it would be cool if you had time to ever do another episode where we would like come back and we can ask specific questions. Because I think opening up the audience now to like all of this information, obviously everyone go follow you on TikTok. Is it just the Onk Donk?
Onk doc, like as in doctor. I've gotten donk a lot, and I don't know if it's like a phallic thing or what is that donk?
Probably a little bit. She got a donk, like the onk doc.
The onk doc for
on
oncology
Insta
doctor
and TikTok,
and TikTok and YouTube.
YouTube. I didn't
YouTube's
know how
my
YouTube.
more. I mean, it's really weak, but those are the more serious videos. So where like if you have a family member with cancer, like I'm trying to just give a basic outline where you can ask your oncologist and be like,
oh, that's great.
Yeah, because that again just makes you feel like, okay, I have some kind of understanding of this.
And is it dumb to say like reach out to you because you're very busy and you already answer so many questions on TikTok? But I feel like sometimes people immediately go like, oh my God, I'm listening to the thing, I have a question, like I'm just gonna find him and ask.
I mean I wish I could give like personal advice about this stuff. Like it's not that I'm afraid of the legal part, because a lot of doctors are like, oh, it's illegal, whatever. It's not even that. It's just it's never
enough.
It's never enough, the blood work or anything, because like I do have to have a comprehensive like question stuff, because then I'm giving you what I think could be the case and I could be misleading you, and that's where I'd feel unethical. I would rather do no harm than whatever that phrase is.
You'd rather
do no harm. Do no harm. So like if I'm placating or assuaging you and I was incorrect because I didn't think to ask this one thing I would have asked if we were face to face, then I'm leading you in the wrong direction.
Then it's not worth it.
And I shouldn't be comforting you, and maybe you shouldn't. So that's the issue.
It's safe
but
to say,
general questions or what you should ask your doctor, I'm totally about that, because
awesome.
Again, peace of mind is invaluable, and then you have that to say, you have that extra just kind of chip or
I said, it feels like a friend like in that space, which I know even as a strong ass, loud ass, independent Leo woman, I still even get like a little bit like, am I allowed to ask this question about my body, like to you, sir, who has given me like your time, and you cost $250 an hour?
Nobody should feel that way. Like I get it, and I get told, and I'm proud of this probably more than anything else. So many times after my initial visit, they're like, "Doc, I was so nervous, and I just feel so much more comfortable with you." Like, and sometimes they've seen the surgeon or radiation oncologist, but like that's my goal, and that's how you should feel. There's literally no reason to be nervous.
Well, no, I mean genuinely, like you're changing my fucking mind about like how I'm like all my relationships. Like I'm about to call all of them and end it for everyone. Like no, but
you deserve. I mean, you deserve to feel heard.
You deserve it for like the 5th time really is striking me. Like the same way it's like I need a quarterback. I need the confidants to hear like, we do deserve to be heard, and
you do. Like you're making me tear up. Like I feel like I feel like it makes me sad that people don't feel that way. Like I feel very strongly that it is. I thank the families and the patients, especially like cancer, but blood too. Thank you for giving me the privilege of taking care of you.
I'm not okay.
It's a privilege.
I'm not
But it's like, it's your health. It's the most important thing of you day to day. I know, but it's a privilege. Like you are entrusting us to do this for you.
Wow.
And if you feel that a person doesn't feel privileged or take that seriously for you and your health, your quality of life on a day-to-day basis, like, they don't fucking deserve you.
Ooh, that's like for men too. You hear that? If they don't fucking treat you like you're a human and hear you. Okay, I get the side tangent. That is, again, so poetic. I think you brought a lot of philosophy to this conversation that I was not expecting. I was expecting to like cut you off every 3 words and be like, what does that mean? What does that mean? I don't understand. Can you say that again? Can you spell it out for me? Let me write this down. But thank you for doing this.
Yeah.
And thanks for
having
being
me
over here and being my friend and like coming last minute. And I mean, literally, you're in LA for 2 days and you are here.
I opened my whole day for you. Seriously, I'm a huge fan of yours. I think what you're doing is an awesome thing. And all of y'all, everybody for listening. I'm really proud of people wanting to take control of that kind of thing. Well,
I was just going to ask, like, what's next for you personally? Because I hear you are popping off in the game of entertainment / doctorly things.
Yeah, I don't know. I was describing to one of my best friends in med school just today. I was like, it's a fog, and I'm starting to see some kind of picture, but it hasn't precipitated yet. All I know is social media has equipped me to not just benefit the patients that I take care of, but I can just like amplify. If I took the education for 15 years and I was able to get that, that kind of education, I feel like it needs to be amplified.
Yes.
So as long as I'm doing that, I feel like I'm in the right direction. But
I'm so glad you say that. Like every time, especially some doctors that I have where I'm like, please let me make you a TikTok. Like I will come here, shoot a bunch of content with you one day and help you release it. And they're like, no, I don't want to be seen on that thing. And I'm like, then why are you a doctor?
Right.
What are you doing? Like if you won't teach people and you won't like use what you have in such an easy, accessible, relatable way. But I guess they're not just all as good looking and cool and can dance like you. I mean, truly, this man can fucking dance. I
was going to say, yes. I think like it's not just to doctors, but with people, I really feel that if you lead with integrity, like people, and this goes for anybody with your content or whatever, like you should worry less about what is going to be perceived. And that if you are acting in authenticity, we are all equipped with that sixth sense to be able to extract or understand like authenticity. Yes. That's like innate human nature.
It's like you can tell bullshit from a mile away.
Right. So if you have integrity and you're operating with that and your authenticity, that will be perceived. And that's why I don't worry about, and I'm sure I get some hate with, maybe some other doctors in the city and stuff. I'm sure some people, hating is also just a principle, right?
You can't
and I'm sure people are like, what is this guy? Like, whatever. But like that at the end of the day, I'm like, I know that's not my purpose. It's not to flex or anything on them. It's so that like people can just
I'm so happy for you.
Thank you.
You're fucking living, preaching the word, family, life, wife. Like, good for you.
Thank you.
Does anything go bad? Is there name one bad thing about you before we leave?
No, I mean, I like, yeah.
Literally, he's like, I don't know. My philosophy and mindset has taught me to just have such a beautiful outlook on life. I can't possibly.
No. I mean, I have my insecurities a lot of times, and I still have imposter syndrome, especially even with social media stuff. Yeah. I mean, like, all of this has happened to me in like 6 to 8 months.
Fair. That is kind of a whirlwind overnight thing.
Yeah.
But now you have me. I can help you in any way. I am a queen at fucking social media. You are. Just let me know.
But I just want to make sure, like, sometimes, like, again, like, everyone, I think, has doubts. And if you're doing it sincerely, you should have doubts. If you don't have doubts, you're probably, like, a little, like, dense or ignorant about, like, you're doing something reckless. Right?
In life. So many good nuggets.
It's again, it's just my patience and everything I've learned from like it's,
that's also a good point. You get to be around so many kinds of people.
Yeah, they're at the end of their lives. And
oh wow, wisdom.
Yeah.
Have you ever read any of those books that are like the things people say on their deathbed or whatever?
Yeah, those are so
so inspirational. They're like Chicken Soup for the Soul books. I just aged myself there. Do you remember those Chicken Soup for the Soul books?
Yeah. My gosh, I forgot about them until just now.
Just now, right?
Yes, it's probably been decades since I even thought about that. Yeah,
I had those books, but like all of those always made me feel really bad because I was like, I'm not living authentically. Like I'm not being my honest, true self. Okay, the Onc Doc.
Right.
SANJAY, Dr. SANJAY, where can people find you?
Yeah.
Where can people find you?
Instagram, TikTok, and YouTube, the Onc Doc. And then my wife and I both practice in Baton Rouge, Louisiana. And
but don't bother him.
No.
Unless you're like sick.
If you have happy to see you and take care of you.
Yeah. All right. Well, confidants, if you have any more questions, he's already agreed. You heard it on camera. He's going to come back and answer some fan questions. We might do it over Zoom if you're going to be all the way in Baton Rouge. But at the rate you're going to be an LA superstar very soon. So you might just come back.
That'd be awesome.
Don't forget you can rate this on iTunes 5 stars. If it's any less than 5 stars, please don't rate it because I am sensitive, just like my sweatshirt says. Speaking of, the merch is available. I need to get you some merch.
I need to buy some. I'm
going to get you some. And also a book so you can see how fucked up I am. You can read about my coke habit. I was actually hoping that
you would sign one.
I have one. I'll give you an extra. I have a lot of my own books laid up around my house because I'm very proud of myself. That's it. Confidants. We'll see you next week. Bye. Thank you all so much.
Yeah.